Today's video is going to be talking about fibroids or leiomyomas in black women. Um, if you hear there's kind of a harsh blowing noise in the background, I'm actually recording a little bit earlier in the day today, so I'm kind of ripping and running around. So I had to, I wanted to definitely have this video done by today, so I'm on the run. But yeah, so talking about leiomyomas or fibroids in black women, and I just want to the few people who are seeing the videos or whatever, subscribe, comment, like, let me know what you would like to talk about, or if you would like to just comment, rate, subscribe, give me some feedback. Talk to me. I'm listening, or I'm seeing, looking out for messages and things like that. But today I wanted to sort of quickly go over this, because in the point of me doing these videos are because I kind of at least in my community, I see that a lot of black women, they're plagued by these diseases, or these diseases are kind of a problem for a significant portion of them, but they don't have a lot of information about it. They don't have a lot of sometimes they might not even know that they have it. Like this disease in particular, leiomyoma or fibroid disease in the uterus, is basically this situation where your uterus has these overgrowths of uterine tissue, and it's not quite endometriosis, which it's kind of similar, but it's not quite that. It's more concentrated in the uterus, and it's more of a fibrosis type of thing, like it's not so much regular endometrial tissue that's growing. It's kind of hard and nodular, but it does cause a lot of pain. It does, it is kind of one of those things, like, a lot of women in general think, that periods are supposed to be excruciatingly painful, which, sometimes that's the case and there's nothing wrong with you, but then other times you have a excruciatingly painful period that you can't go to work on days that you're having your period, or you can't, do anything because you're in so much pain, and no, medications aren't working and stuff like that. You're having a lot of bleeding, a lot of, different irregularities with your period or something, and it can sometimes affect your sex life also. So it's important to kind of know about this, and be able to go to a gynecologist you can trust, that's going to have your best interest at heart, to figure out if you have it, and then if you have it, what to do about it, what's the best approach. But I'm talking about this particularly because it's the development of it in black women is kind of interesting, and based off of my experience, based off of my knowledge, there's kind of three theories going around out there about as to why black women in particular are more likely to develop this disease. First of all, there's the relaxer theory. I think they did a study in South America somewhere where they were talking about how, I guess, some chemicals from the place that made hair relaxers got into the water, and they noticed a lot of women there had fibroids, or it went something to the effect of that. I don't really remember exactly what all the articles said, but it was something like that. and they figured that maybe hair relaxers contribute to fibroid growth, which, you know, we need more studies to definitively say that, but I wouldn't be surprised. Relaxers are very dangerous, caustic chemicals, and they're actually, I think some people actually, especially naturopaths, actually contraindicate relaxer use during pregnancy and birth. So, you know, there may be something to that. But there's one thing I particularly wanted to talk about was the female sterilization, which is basically getting your tubes tied, and the precocious puberty theory that I think contributes to fibroid growth in black women. So for the female sterilization, that's getting your tubes tied. And while that might seem like a harmless, you know, method of contraception, when you get your tubes tied or burned or clipped or something, that messes with the physiology a little bit, because we're not exactly sure. I think we're not exactly sure about exactly how a lot of hormones, you know, get around through the body and, you know, do certain things. We have an idea that, you know, maybe, you know, certain hormones, you know, travel more through the blood, and, you know, and they get around in adequate amounts that way. However, if you and I may do another video to explain how the uterus works or how the fallopian tubes work or whatever, so that I'm not like bogging you down with too much physiology or anything. But there's definitely something to that. There's something, I could see how getting your tubes tied or clipped or burned or whatever they do to do this female sterilization procedure, I could definitely see how that could lead to excessive endometrial tissue growth that could promote fibroid formation. I could definitely see how that could happen. And then there's the precocious puberty idea. Black women on average are more likely to, especially these days, which it's been sort of getting worse over the course of history. Black women on average are more likely to start puberty earlier than other groups of women, whereas other groups of women maybe start puberty about 12, 13. Black women on average are more like 10, 11. And while that might not seem very important, or other groups start at 13, 14 sometimes, you know, while it might not seem like too much of a problem, but the fact that you start puberty earlier and you're exposed to more estrogen for a longer period of time, that's been actually shown to not only increase rates of endometrial growth and things like that, but it's also shown to increase rates of cancer, like breast cancer, even different types of you know, reproductive cancer. So there's that too. And the reason, and there's a couple of reasons why I believe black women endure precocious puberty. One of them is because, well, actually the main thing is black women, like I've mentioned in videos before, black people in general are more likely to live in poverty or live in destitutiveness, or you know, we're more likely to be struggling all our lives, especially in childhood, than other groups of people are, which increases stress, and stress increases cortisol. Cortisol causes obesity. Obesity causes increased estrogen, and increased estrogen causes precocious puberty. So there's that theory as well. But I just kind of wanted to talk about it and sort of link lifestyle to pathophysiology of this disease, just so that black women especially can have more of an understanding of kind of what are some of the causes and what are some of the things that they can do to maybe prevent it from happening, or maybe prevent it from happening to their daughters or loved ones or things like that. Once again, I always encourage you to get with a gynecologist or any, practitioner that understands you and that looks out for you and that's going to care about you and actually, treat you like the human, the important life form that you deserve to be treated like. But yeah, that's basically it. Please like, comment, subscribe. Let me know what you think. Let me know what you want to talk about. And that is it. Y'all have a nice day.